morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of the Coronavirus Task Force and Chair of the Metropolitan Board of Health. Also joining us today will be Dr. James Hildreth, President and CEO of Meharry Medical College. And also, we welcome Heather Rohan, Division President of TriStar Health. We'll begin now with Mayor Cooper.
Good morning, Nashville. I want to start by thanking everyone who celebrated Thanksgiving with smaller in-person gatherings this year. Limiting our social contacts does slow the spread of the coronavirus in Davidson County. It really does, and so thank you. Today, however, our 14-day average daily case count is 494. That's a 27% increase over what we reported just 2 weeks ago. Our average of new cases per 100,000 residents is 69. That's a 19% caseload higher than our last briefing. The COVID-19 outbreak in Nashville is now at an all-time high. During the past 2 weeks, we've gone from 336 to 440 active COVID hospitalizations here in Davidson County, a 31% increase, which strains local hospital resources and is especially hard on our frontline healthcare staff. In response, at least one Nashville hospital is pausing elective medical procedures because of this surge. Now we must do our part to reverse this trend by wearing masks, social distancing in public places, and avoiding crowded spaces. Of all the tools in our toolbox, mask wearing is our most valuable resource, and when worn every trip, every time, properly secured over your nose and mouth, even among friends and family members outside of your household, masks protect us and those around us. Now, a vaccine is not yet available to the public, but we are expecting a limited initial supply in the next several weeks. And we're working closely with the state of Tennessee on a responsible distribution strategy that considers essential personnel throughout Davidson County and has the greatest positive public health benefit for our community. Dr. Gil Wright from Metro Public Health is here to help answer questions about this developing strategy, and he will present more details about Metro's plan at next week's briefing. Now, recently, Dr. Birx of the White House Coronavirus Task Force advised anyone who traveled or gathered in larger groups over Thanksgiving weekend to remember to also get tested when they return. It's a sensible and safe measure. COVID-19 tests are free to everyone at all 3 Metro Community Assessment Centers, and you can call the assessment hotline for more information at 615-862-7777. Now, there was a recent backup at labs that created an unacceptable delay in test results. But labs worked over the Thanksgiving holiday to process this backlog, and we will continue to work with the state to reduce these turnaround times. So please don't delay in getting your free COVID-19 test. As a reminder, our public health orders have been adjusted to slow the spread of the virus in Davidson County. Restaurant capacity is restricted to 50%. 10 p.m. last call for service for food and beverage, and there's no entry at restaurants and bars after that last call. The new gathering size maximum in Nashville is 8 people, down from 25, and again, this rule of 8 aligns with the maximum dining party restrictions currently in place in Nashville. Remember the rule of 8 as you make your holiday plans throughout December. Healthy habits help us keep our economy running, and we have many local businesses that are operating safely this holiday season. Supporting your local small businesses can be done without any health risk. They are working very hard to keep us safe, and they deserve your support. As we approach the holiday season, it is my pleasure to introduce this week's community heroes, Music City Bronze. Nashville's premier community handbell ensemble has performed across Middle Tennessee for 14 years, bringing holiday cheer to thousands of our neighbors during this special time of year. The COVID-19 crisis has not stopped these dedicated musicians from safely sharing their talents. Visit musiccitybronze.org to view a special 1-hour holiday handbell presentation. It's family-friendly, light-hearted, filled with everyone's favorite Christmas classics, and a fabulous way to ring in the season. Please join me in thanking all the members of the Music City Bronze for safely spreading holiday cheer in 2020. Now this morning, I'd like to welcome Heather Rowan, Division President at TriStar Health, who is joining us virtually. Heather is one of 9 leading hospital and healthcare executives who co-signed an open letter to all Tennesseans urging extra personal precautions to reduce the spread of COVID-19 and help prevent our hospitals from becoming overwhelmed. She's here with us today to reiterate that important public message of how we can help our frontline healthcare workers during this difficult moment. And as always, it is my pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's here to discuss the coming COVID-19 vaccine and the rigorous approval process it has gone through, and why all Nashvillians should feel confident in taking this vaccine when it becomes available. Dr. Hildreth's background in both patient care and in drug development makes him a voice we can and should trust. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here is the latest on coronavirus in Davidson County. We currently have 3,164 active cases. At our last update 2 weeks ago, that number was 3,799. Our total cases currently is 48,492, and that's an increase of 810 cases from yesterday. Our 7-day average of new cases per 100,000 is 68.9. This is consistent with where the state of Tennessee is, and this ranks us at 50th out of 95 counties for the state. The 7-day positivity rate has increased to 11.5%, and our last update we were at 9.8%. Now, the total number of tests conducted in Davidson County has hit a number of 688,292. And just last week, 33,500 individuals were tested. 374 Nashvillians have died because of this virus. While that mortality rate appears low at 0.74%, I do want to highlight that a mortality rate is 10% for those between 75 and 84 years of age, and 14% for those who are 85 years and older. Our transmission rate currently is at 1.2. Now, hospitalized patients in Tennessee is as follows. In Middle Tennessee, there are 757 individuals hospitalized with COVID-19. That's a rise of from 686 1 week ago. And in Davidson County, that number is 440 individuals, again up from 409 just 1 week ago. Now, yesterday, the CDC adjusted their quarantine guidelines for those who have been exposed to someone who has the coronavirus. Now it is recommended, if you do come into contact with someone who does test positive, you quarantine for 10 days and resume normal activity after the 10 days if you have not had any symptoms. And it's actually 7 days if you have had no symptoms and you receive a negative test result within the last 48 hours of your estimated end of quarantine. So essentially a negative test on day 6 or 7 if you have had no symptoms. Now, the CDC in the report actually went on to say the following, and I think this is really important. These recommendations for quarantine options shorter than 14 days balances the burden of being quarantined against a small but not a zero risk of post-quarantine infection. So what this means is this. You should still watch closely for symptoms of COVID-19, such as fevers, cough, loss of smell and taste, diarrhea, for the full 14 days after exposure. Now, the news about a vaccine is also very encouraging, and it gives us hope that the beginning of the end is near. Metro Public Health continues to work with the state on a broad distribution plan, and in fact, they've been working on this plan for months. And it will be quick, and we will quickly make the vaccine available once we receive it. Now, we're also working on a distribution plan for healthcare workers and first responders here in Davidson County. Once we get the vaccine, we will immediately begin to administer it to those identified by the priority phases in Phase 1A. And then we'll continue to phase in everyone until everyone in Davidson County gets a vaccine at the appropriate time. And that is honestly the key. For this vaccine to be effective, everyone needs to get the vaccine. Now, the vaccine is what will end this pandemic. However, for it to work, again, I want to reiterate, we all must get the vaccine. But until that is available and there's a broad distribution of that vaccine, we need to continue to remain vigilant. Do the things we all know about. Wear masks, socially distant, and stay home if at all possible. Now, it has been 1 week since Thanksgiving, and if you have traveled or if you've been in large gatherings, please get tested. You may have been exposed to the virus, and the only way to make sure is to get a test. Our community assessment centers are open today and tomorrow until 2 p.m. And also next week, December 7th through the 9th, we are increasing our hours of operation from 7 a.m. to 3 p.m. due to the estimated increase in testing. But I do want to remind you to please check each day, as with temperatures dropping, the sites may be temporarily closed early in the morning for the safety of our personnel at those sites. Nashville, I'm really grateful for everything you have done now as we enter month 10 of this pandemic. And I just want to thank you and stay vigilant. And I'd like to introduce Dr. James Hildreth. Thank you.
Good morning, Nashville. I've been appointed to the Vaccine and Related Biological Products Advisory Committee of the FDA. A week from today, on December 10th, we will meet to review the data from the Pfizer COVID-19 vaccine trial. We will vote on whether to recommend approval to the commissioner. A week later, on December the 17th, we meet again to review the data from the Moderna vaccine trial. Both of these candidates have shown great efficacy, more than 94%, and each were shown to have really good safety profiles for the duration of the trials. Importantly, both of these vaccines were shown to work well across age groups and in individuals with pre-existing conditions. They both also drastically reduce the likelihood of severe disease, which is really extremely important. Another exciting aspect of these two vaccines, at least from my perspective, they represent a brand new technology for vaccines, messenger RNA. The difference is that traditionally vaccines are composed of heat-killed viruses or proteins representing parts of the virus. In this case, mRNA is injected into the body, our cells take it up, the cells make the proteins, and then the immune system responds to it. One of the reasons why this technology is so very important is it drastically reduces the time and effort needed to identify a vaccine candidate. So going forward, this technology may well mean that for future pandemics, we can quickly produce vaccines as we've done this time. So it is likely that before the end of this year, tens of thousands of people across the country will be administered a COVID-19 vaccine. You need to understand how remarkable this is, and it will go down probably as a triumph of big science to have developed vaccines in the span of 10 months, 10 or 11 months. Many have questioned me or asked me, how can a vaccine possibly be safe or effective being developed in such a short time? I'd like to offer you a few thoughts to assuage your concerns and fears. First of all, none of the steps required to determine the safety of a vaccine was omitted in these trials. None of them were. The speed of developing the vaccines can be related to a few things, and I'd like to share some of those with you. First, the technology devoted to this vaccine effort is truly amazing. The genome for the virus was published in early January, and less than a month later, at least 2 vaccine candidates had already been identified. This process alone used to take a year or more. In fact, sometimes it could take 2 or 3 years. Second, the fight against COVID-19, developing a vaccine, took advantage of a robust, large, long-standing infrastructure designed to produce a vaccine to HIV. It was called the HIV Vaccine Trials Network. This network consists of some of the top academic institutions in the country, including Vanderbilt, and I'd like to say Meharry. Those also include some of the top researchers who work on vaccines in the country. The HIV Vaccine Trials Network was asked to pause and pivot and focus its attention on COVID-19. That is one of the reasons why the vaccine trials have been able to move as rapidly as they have. The other thing that's very important is the vaccine effort for COVID-19 took advantage of lessons learned from previous vaccine efforts, including Ebola and Zika and some others. And the other thing that is really, really important is the administrative processes unrelated to the science or the trials was made much more efficient. And I cannot overlook the fact that we've had an unprecedented collaboration between large drug companies and agencies of the United States, including the NIH. This public-private collaboration allowed a scale like we've not seen before. The scale of this effort is just truly amazing and very impressive, and that is another reason we can have more confidence that the data on safety and efficacy is real and can be trusted. Let me just say that the fast pace then does not preclude safety and efficacy, and if the committee votes to approve the vaccine, I will be encouraging my family to take it and all of those that I care about, because this is the answer to putting the pandemic behind us. So the bottom line is the vaccines have gone through a rigorous process. It was accelerated for a lot of reasons, but none of those steps that are needed to prove that it's safe were omitted. And if the committee votes to approve it, I encourage all of you to accept the vaccines when they become available. So I'd also like to mention that the committee that will vote on the vaccine consists of independent experts from around the country. None of us are affiliated with the drug companies or the agencies that are involved in developing the vaccines. The trials have also been overlooked by a data safety monitoring committee. This committee consists of independent experts and patient advocates who watch the data continuously, and if there were any signs of safety concerns, they would have the ability to stop the trials and have the data examined. So there have been lots of levels of oversight, and I can assure you that the steps needed for safety have not been overlooked. So lastly, imagine that you devoted your whole life to saving lives and taking care of people, and you've done that for decades successfully. Imagine now that day after day, week after week, month after month, you're surrounded by death and dying and really sick people. That is the story for many healthcare workers who are on the front lines today. Some of them have to stand in for family when people take their last breath because families can't be there with them. So you think that you're weary and tired of the pandemic. Imagine how weary they must be, how tired, how drained, how physically exhausted. We've lauded them as heroes as we should have. We've given them accolades that they well deserve. But I would venture to guess that much more than our accolades and elevating them as heroes, they would like us to be their heroes now. What does that mean? That means wearing a mask, keeping your distance, avoiding crowds, and not turning up in their wards so they have to take care of you. Our heroes need heroes. Nashville, we've got this. Please, let's do our part to control the virus until the vaccine becomes widely available. Thank you.
Thank you, Dr. Hildreth. Now we'll hear from Heather Rohan, Division President of TriStar Health.
Hear me okay? Can you hear me? Good morning.
Good morning.
Hi, good morning. Good morning, Nashville. Thank you, Mayor Cooper, for this opportunity today. At HCA TriStar Health, we believe it's a privilege to care for the patients that need us in Nashville and the surrounding area. I would venture to say, and I know that my colleagues at Ascension, Vanderbilt, and all of our regional hospitals feel the same way about the goals we have in taking care of those that need us. Last week, we sent a letter to all Tennesseans, an open letter that was signed by all of us and put together to impart the seriousness of the situation today. The precipitous increase in patients that we've seen in COVID that have filled our hospitals, our critical care units, and have stretched our staffing in all of our facilities. There's a slide, I had two of our caregivers, our frontliners, I don't know if that's available, but just to highlight Dr. Michael Nottage, the director of our critical care unit, thank you, and Lauren Manticus, a new nurse, but a nurse that has chosen to work in our COVID ICU. These two individuals represent thousands of frontliners that are walking through the doors every morning at 6:30, every night at 6:30, and being there to take care of the patients and their families. And so when we think about this, the importance of the need for us all to come together as a community and all do something to help this situation today. It is so great. It's great news to hear what Dr. Hildreth had to say. There's great news on the horizon, but that news is not happening today and it won't be tomorrow. So when we think about what can I do as a community member, what can I do today, what can I do tomorrow? Today, I can wear a mask, socially distance, wash my hands, and as the holidays approach, think about carefully and cautiously thinking about how we go about making sure that these holidays are safe. The most important times are before us right now. And so what can you do? You can do a lot. We're going to be there for you to help take care of you and your family and your loved ones. Be there for us. Please put your mask on, wash your hands, and socially distance. Thank you so much for your allowing me this time today to speak with you. And thank you for everything, again, that you do in this community, Nashville. Thank you.
Thank you, Heather. Well, I also want to make sure that we are aware that we also have Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, Dr. Michael Caldwell from the Nashville Public Health Department, and Chief John Drake of the Nashville Police Department here to also help answer your questions. We'll start with the first question with Tosin Fakili from Channel 4. Tosin?
Hey, good morning. Thank you for taking my question. I had two questions. The first is to Mayor Cooper. How do you guys go about, I know you said you're working with the state to prevent more backlogs. How are you guys going to work towards doing that so we have, more accurate numbers when we get the COVID numbers for Metro and the state? And also to Mayor Cooper, are you, with the numbers going up, and are you planning to put up any more regulations to kind of help curb the spread of this virus? And my last question is to Dr. Alex Jahangir. Even though I know you said you read the thing about the CDC reducing quarantine, any thoughts on, is now a good time to reduce that quarantine period in terms of COVID numbers going up, not just in Tennessee, but across the country? Thank you.
Thank you, Tosin. And Channel 4, I'll ask Dr. Wright to talk about how we in the state are responding to the backlogs and what were some of the issues in doing that. I think under your question for me was additional regulations on the economy, and the encouragement of wearing masks is going to allow us hopefully to stay in place where we are. With community spread, you do have a circumstance where what is happening at home and in your backyard is really where we're spreading the disease. And these are areas where you can't regulate your way to success. Now, we do want to be declustering the county and to have less opportunity for disease spread in the public space, in the public platform, but community spread creates a condition where it's at home. It's doctors are getting this when they go home and are out in basically the private environment. And so much of our encouragement today is based on what you do at home is important, what you do with your family is important, and don't feel that you can regulate or enforce your way, or we can't regulate and enforce our way out to disease success in Nashville at this point. It's going to require everybody working together to do that. And with that, let me turn it over to Dr. Wright, whose work and public health's work, let me just say, along with all the other healthcare workers in Nashville, it's been a year of great challenge, and I'm grateful to the extra hours and dedication that they are putting out for all of us here in Nashville. And as a Nashvilleian, I just want to thank them.
Thank you, Mayor Cooper. Yes, we've been working very closely with our labs for our assessment centers, well as all of the labs that we're working with for any testing. There was a backlog, and that backlog occurred partly due to an issue with some reagents being available. The Path Group, who is our main lab for the assessment centers, was able to bring up a new piece of equipment that essentially doubles their capacity. It is a different brand of equipment requiring different reagents, so that will hopefully keep us up to date. They were, during the holiday, able to take all of our backlog, and they have told us that at this point they expect to be able to do all of our labs or return all of our labs within 24 to 48 hours. And they do have plans, I believe sometime after the first of the year, to continue to add more equipment so they continue to handle more and more tests if needed. Alex?
And Tosin, thank you for your question. You know, I think the thing with the CDC guidelines is there's constantly an update of best practices and data, and I think the CDC has been trying to balance the ability to have compliance with safety. And I know the state epidemiologists in our state and our local epidemiologists have been chatting about these new guidelines. I've had the opportunity to partake in some of those discussions. And so I think these guidelines hopefully are ones that will keep encouraging compliance. It's something that I think is really important, and I'll disclose that I self-isolated earlier this week because I was worried. So I'm doing as I'm asking everyone to do. And so to be able to lower the the self-isolation time and the quarantine time in a safe manner, I think makes a lot of sense to increase compliance. So I trust the people who've been working on this. So thank you.
Thank you. Our next question is from Kathleen Seary from Channel 17.
Good morning. Thanks for taking our questions. So this is for whoever wants to answer from Metro Health. We've been keeping track of the information posted by the weekly White House reports for Tennessee. As of November 22nd, they say about half of Tennessee hospitals have only a 2-week supply of PPE, and gloves are the item that are going the fastest. So what is the situation like at Nashville hospitals in regard to PPE, and are we facing a dire situation here like they're portraying for the rest of the state? Thank you.
Thank you. Doctor.
Yes. Well, I'll tell you this. From everything I've had the opportunity to know from our hospital leaders, Heather and others who were on here, I'm not aware of a dire PPE issue here at Nashville hospitals. I feel pretty comfortable making that statement, and I know that our major healthcare systems here in Nashville have been very vigilant to make sure that problem doesn't arise. And so the problem in healthcare capacity right now has to do with staffing and the fact there are a lot of people getting sick, both people who work at hospitals who get sick outside, as well as patients who come in. So I don't think PPE is as has been on the reasons for this issue, at least in Nashville hospitals, and so that's my answer there.
Thank you. Our next question is from Harriet Wallace from Channel 17. Harriet?
Yes, hi, good morning. I am interested to know, to talk a little bit about the situation in our nursing homes. Also, with regard to the White House report, there's constantly mention and concern of the numbers within our nursing homes. Wanted to see from Mayor Cooper or possibly from Dr. Jahangir, what is you all's level of concern with what we're seeing in our nursing homes in this area? And secondly, has there been any discussion with our state leaders with regards to possibly shifting the way that we're approaching care and even quarantine and mandates within the nursing homes? Thank you.
Did you want to do nursing home?
Well, thank you, Harriet and 17. I'll ask Dr. Jahangir and Dr. Wright to comment on this. It's obviously, however, a huge priority for any city, given the mortality rate that exists in our older, vulnerable population, and I think that priority is going to be reflected in vaccine distribution next week when we get around to having more information about that. The older community is for sure going to be a highly prioritized community. So with that, on with Dr. Wright. Thank you.
Yeah. Thank you, Harriet, for the question. Just on early this week, ACIP, which is Advisory Committee on Immunization Practice, recommended that nursing home residents, those older living in congregate settings, which is nursing homes, skilled nursing, be elevated to 1A for immunization. And so the state is considering that. We're working closely with the state on our allocation, and that will now be one of the primary groups. Previously, we had planned to immunize the staff so that they would prevent bringing it in, but now with that change from the ACIP, we will be working on trying to address the residents also.
Thank you, Dr. Wright. Our last question comes from Kara Hartnett with Nashville Post. Kara?
Thanks. Just for anyone, I guess, that can answer, if the EUAs go through for the vaccine candidates, do you know how many doses will be immediately available for healthcare workers just in Nashville? And how often do you expect to be receiving shipments of new doses?
Dr. Wright will answer that.
All of those are great questions. We are working with the state, but the state and the federal government has not disclosed exactly how many doses we will be receiving and exactly when those will come. It will be staged, and initially we will receive some vaccine, and as it continues to be produced, we'll get ongoing shipments. But at this point in time, that's all I know. But we are prepared to get a very small amount to a very large amount and start getting it in people's arms as quickly as we have it. We've worked very closely with OEM and with our own staff to develop a very robust plan to do that and do that quickly.
Thank you, Dr. Wright. Those are all the questions we have this morning. I'd like to thank Heather Rohan for joining us this morning. We are also grateful to Amy Lankite and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing will air on Thursday, December 10th at 9:30. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.